Hey everyone, and welcome to Times of Israel Community Zoom. We are so lucky to be here with Dr. Stuart Akerman. Thank you so much for taking the time to speak with us.
Of
You
course.
know,
Thank you for having me.
we have been talking about COVID-19. We've been discussing poetry and politics and all sorts of things, and this is a change of pace, although not really. It's sort of we're going slightly off the path into something that may be very important and very helpful for you or for someone that you love. So during stressful times, it's not uncommon to feel literally sick to your stomach. I mean, I can speak for myself on that. Ever since the COVID-19 crisis began in earnest, I'm sleeping strange hours. I'm not eating right. I'm feeling off. I'm feeling ill much of the time. And I know that there are others in the community who are dealing with similar issues. And so we are so lucky to have Dr. Ackerman here, a gastroenterologist in Dallas, Texas, to talk a little bit about different digestive systems and digestive symptoms and how it relates to COVID-19 or how it doesn't, or what is worrisome, what isn't, and what we can all do just to feel better and healthier and stronger and more resilient during these difficult times. So thank you, Dr. Ackerman, for being here.
Thanks for having me. And, it's actually a really broad topic to discuss because the interplay between COVID-19 and GI are both on the microscopic and macroscopic level because COVID-19 seems to affect the GI tract directly, but then some of the practices that we're enabling on ourselves with shelter in place and quarantining and social distancing tend to either positively or negatively impact our gut and therefore sometimes our chronic disease processes as well.
How so? What are the positive impacts? What are the negative impacts that you're seeing?
Sure. So a lot of what I'm seeing is our habits are changing, which is not surprising, right? So it kind of, I say positive and negative because everyone reacts to things a little bit differently. Some people have started working from home and it's impacted the way they eat. They're not eating quite the same way. They may not be as regimented. They're eating later. They're not exercising quite the same way. Whereas, other people in the same situation have responded in a 180-degree way. They've become more regimented. They're more concerned about the way they're eating. They've started, maybe now they have more time. They're usually running between going to the office, maybe running to school activities with their kids. They don't have time for themselves. Whereas now with the kids home and maybe they're able to focus on their work, or unfortunately, some people who are unemployed, maybe now they do have more time. So they're going to start jogging or running or, use that piece of workout equipment they might have at home that they haven't been able to before. So, those people might be doing even a little better than they typically do.
I'm seeing a lot of Facebook groups about cooking, one in particular that we covered on Times of Israel called Real Food in the Time of Corona. And it's fascinating to see all these different folks from all around the world sharing recipes, and they all look pretty healthy to me. And meanwhile, I'm, raiding the refrigerator every chance I get. But thank you. So thank you for your insight on that. What foods should we be eating right now in order to optimize not just our gut health, but our general immune system so that we are able to stave off anything or try to stave off anything that comes in our path, whether it's COVID-19 or the common cold or any other bug we might encounter?
So it's a great question. And, when we talk about immunity, we don't have specific data. I mean, there's a lot of positive data that talks about, the utility of probiotics, the utility of various vitamins and their positive properties. The problem is that for all the positive data we have, sometimes we don't necessarily have negative data, thankfully. I don't know that any doctor would tell you not to take a probiotic, but sometimes it's a question of how strong is that positive data? Is it strong enough that you should be recommending it to everyone you come across? Um, when it comes to GI disease processes in particular, I think, some of the most common issues that my patients have been experiencing over the last several weeks as I now transition to seeing them virtually is, sort of the common things that we normally deal with. Bowel habit disorders, reflux disease, and a lot of IBS. So people have chronic issues with irritable bowel syndrome, abdominal discomfort, bowel habit changes, and changes in diet and changes of stress tend to really exacerbate those things. So now more than ever, it's super, super important to be monitoring what we eat. And probably the most common thing you're going to hear a gastroenterologist talking about is fiber. Now, what does that mean? What is fiber? Fiber are digestive products, things that you can eat that don't really get absorbed or digested. So they almost completely pass all the way through you till they hit the colon. And that's where they're beneficial to you. And if you don't mind, I just wanted to, back up a little bit and explain the function of the colon and why it's important
Yes.
when it comes to, constipation and bowel habit regularity.
This is
So
especially important for those of us keeping Passover and eating a lot of matzah and seeing some differences in our system because of that. So thank you.
yeah, for sure. There's actually a ton of research dedicated to Passover, matzah, and the Jewish gut. So the colon's function is really more for water absorption. There's a lot of I wouldn't say misinformation, but misrepresentation sometimes about the colon function. And sometimes people don't understand that when we talk about your intestine, there's way more small intestine than there is large intestine, which is also called the colon. And the small intestine functions also in water absorption, but more in digestion. The colon is your last stop as a resource to be able to reabsorb water. And it works a little bit for electrolyte balance as well. So since fiber is, not really digested very much, it'll travel to the colon largely intact and therefore can act as a building block or scaffolding, if you want to think of it that way, of stool. So if you have a lack of dietary fiber, you don't have those building blocks, it often will lead to constipation. On the flip side of that, if you have inadequate water intake, your colon has to jump into action. Your colon's going to get signals to say, hey, we're dehydrated. We really need all the water that we can retain. And it will sort of dehydrate all the other products that are in the colon, again, leaving you with constipation. So adequate dietary fiber, adequate hydration are key components to bowel regularity. And both of these things can be problematic now.
Yeah, I can understand that. What else besides the irritable bowel syndrome and the colon? You mentioned also reflux. Can we talk a little bit about that and what foods to eat, what foods to avoid, and how stress plays into that as well?
Oh, absolutely. So, GERD is a buzzword we hear about a lot, and probably the most common symptom that it gets confused for is heartburn. And GERD, which is gastroesophageal reflux, is a process. That's a pathological process. Heartburn is a symptom, something you might feel, and they're not interchangeable. You could have heartburn without reflux, and on the flip side, plenty of people with GERD actually don't have heartburn, and sometimes can even be surprised when you tell them that what they're experiencing is GERD. There are many symptoms that you can have, and it crosses over into a lot of other disciplines: heartburn, acid indigestion, reflux, nausea, vomiting. Sometimes people can have trouble swallowing. Cardiologists might send you a patient because they have chest pain or discomfort, and they've made sure that their heart is okay. And sometimes even chronic cough or shortness of breath. And all these things, any or all, can be related to reflux. There are some kind of basic principles that people should adhere to try to minimize any kinds of chance of reflux symptoms. And some of them sound simple, but might be really hard to adhere to. So avoiding late meals because you want your stomach to be empty when you lay down, not overeating, kind of with the same reason that if you overfill your tummy, it gives a lot of opportunity for things to go backwards up into the esophagus. And when you lay down, you shouldn't lie flat. You want gravity to still be able to be your friend. So either prop up a couple pillows, or if you're like me, where you start with two and end up with no pillows, maybe a little wedge under the mattress can help a little bit. And there are certain foods that constitute what we call the GERD diet. Those are things that tend to either elicit more acid production or slow down the gut and allow for more reflux. And those are the things that you want to either mitigate or avoid. And it's actually, it sounds like an exhaustive list, but it's actually not. And a lot of times knowing is half the battle. If you know about these foods and you can pay attention when you're eating, you tend to mitigate your symptoms. So what are those things? Probably the most common and the most acidic thing we eat are tomato sauce and concentrated tomato products like tomato sauce, pasta sauce, ketchups. That's why certain foods like pizza and pasta tend to be more problematic. Yeah, the things that everyone loves, right? And coffee, citrus, and alcohol, and in particular beer and red wine. These tend to be more problematic. So again, I would caution that if you want to have that glass of wine, maybe drink white wine, and don't drink it right before you go to bed where you're sort of at your most susceptible. We talk a lot about spicy foods, fried foods, and then kind of the ones that surprise people are chocolate and mint. They tend to also be quite irritating to the stomach.
Huh. Never would
And
have thought of mint. I mean, whenever I had an upset stomach, my mom always made me mint tea. No
yeah,
wonder I
it's a
never
little
got
counterintuitive
better.
because we know that there's some amazing properties of peppermint for the gut. It tends to calm the gut. And it's actually been a huge boon to people with irritable bowel syndrome. A lot of the therapies and symptomatic treatments start and end with peppermint oil. And but when it comes to reflux, sometimes it catches you both ways. Um, and then, unfortunately, some people do find, but thankfully a much, much smaller percentage, that dairy and onions can be problematic as well. So I kind of tell my patients, if they come back and say, I've been doing really well with the diet, I feel really good, but I notice if I have a little bit of milk with my cereal, I get the same kind of reflux symptoms, but that doesn't make sense. And I'll say to them, yeah, it technically might not make sense, but there's a lot of people who are in the same boat as you. So something that you should pay attention to.
Is there, a lot of Jewish people I know, including myself, have some sort of lactose intolerance issue, whether it's super severe, like we've got to just cut out milk entirely, or mild, or for instance, since we're talking here, yeah, I can eat yogurt, I can eat cheese, and I'm totally fine. But otherwise, I'm not so fine. So, is there something to that, like especially amongst Ashkenazi Jews? Is there something going on, or is this just anecdotal?
Yeah, I don't want to say you're weird.
Well, I am.
Yeah, this seems to be somewhat genetic. I remember, back in medical school, we talked about the two variants where, so I should probably back up. What you're alluding to is difficulty processing lactose. And in order to do that, you need to use an enzyme, which is found on the wall of your small intestine called a lactase enzyme. And that might be why you see commercial products like Lactaid, which is a brand name of a lactase enzyme that you could literally eat, so that if you don't have it on your small intestine, you take it with the milk and it can break down some of the lactose. There are two variants that we see. We see people who make some but not enough, and then you see the people who don't have it at all. And you could usually figure out who you are just based on your symptoms and the way that they present. If you're someone who can have some things and not others, or that 1 ounce of milk with your coffee in the morning seems to be fine, but if you've got a slice of cheese, you're going to be bloated and gassy, you're probably someone who's got some amount of enzyme. And if you stay below that threshold, you're doing okay. But if you're someone who that 1 ounce of milk can't even tolerate, you're someone who's got true, complete lactase deficiency, lactase deficiency. And, you're someone who may benefit from, a lactase supplement, which works great. And for a lot of people, it's not perfect. And it's kind of hard to know how much enzyme you should be taking with your dairy. But nowadays, thankfully, there's so many products that already have the lactose broken down.
Mm-hmm. But is there anything else that you think that we should know here at the Times of Israel community about our gut health, about staying healthy? Actually, I also wanted to ask you if there is a connection between stress and digestive health, if one impacts the other, if it's hard to tell which came first, um, the gut that's overrun with bacteria and stress, or if stress impacts the way that our bodies process food and hold on to certain kinds of bacteria.
Yeah,
So
so
before we
that's
get,
it's a little bit of a tricky question because the answer is both, right? I mean, and it becomes a little bit of a chicken and egg phenomena. So when we talk about irritable bowel syndrome in particular, right? So irritable bowel syndrome, first of all, it's really important not to confuse IBS, which is irritable bowel syndrome, with IBD, which is inflammatory bowel disease, because they're very, very different things. IBD is an autoimmune disorder, right? And it requires special kinds of drugs to suppress that immune response. Whereas IBS, or irritable bowel syndrome, is what we consider a functional bowel disorder. It has it's sort of a way that or a problem with the way that you process stimuli, and it's an abdominal syndrome. It typically involves changes in your bowel habits and abdominal discomfort. We tend to clinically diagnose that. And what does that mean? That means that there's no fancy tests, right? There's a lot of times the tests that you're doing are really there to make sure that nothing else is going on. And if you fit that clinical profile, will tell you that you have irritable bowel syndrome. There's actually something called the Rome criteria, which is a bunch of really smart people who got together in Rome and figured out that there's a certain number of check boxes that if you can successfully hit, you probably meet criteria for irritable bowel syndrome. And the reason why it's important to do that is that it allows you to understand that it's a syndrome and not a disease. And therefore, the goal of therapy is really symptom control. You want to avoid that pendulum swing where you get a stimulus and now you're really symptomatic. And because you're really symptomatic, you can't eat and you're having pain and your bowel habits are all irregular. So by treating, you might decrease the stimulus, you might decrease the stimulus response. And when it comes to IBS, no two patients are the same. If you go into, a Facebook group or a chat room where people are discussing their IBS, you might have, two people who say, "Oh, this herbal remedy or this drug did amazing things for me." And then three people after them are like, "What are you talking about? I used it for a month and absolutely nothing worked." And they're all right, right? I mean, it's a very individualized response. The things that tend to bother people or to make that pendulum swing are input. And input tends to be lots of different dietary factors, a lot of the things that we've already started touching upon, and stress. Stress seems to be a very large component for exacerbation of irritable bowel syndrome. And now where people have all different kinds of reasons to stress, stressing about
yeah,
their job, stressing about money in the economy, stressing about their health, both related to their chronic illnesses and what's going on with coronavirus. These are unfortunately a huge setup for exacerbations of irritable bowel syndrome.
you must be getting a lot of calls. I know of at least one call that you got last week about all of this, and I appreciate you taking the time uh, to talk us through it. And so before we wrap up, because I know you've got to go see patients and you have a busy day ahead of you, is there anything you think that the community should know as we move forward?
Yeah, it's interesting. I conducted a pretty informal research poll recently where, I wanted to see if there were any trends
Mhm.
relating to this, right? Because it sounds great on paper and we discuss it. It sounds like it would make a lot of sense, but that's kind of how it works in research, right? Sometimes you have a hypothesis and it makes all the sense in the world, but it doesn't pan out when you look into it further. And I sent out a pretty simple survey asking people just about their habits now. How do they feel? What are they doing? And some of it was pretty interesting. I got well over 100 responses, and it makes for a nice little data set to discuss. And if it's okay with you, I want to just share the screen for a little bit so we can look at a couple of
Absolutely.
these slides. And sorry, just bear with me for 1 second here. All right, can you see that there?
Hmm.
All right. So one of the questions I asked is, how are people eating, right? How have they noticed any dietary changes? And it's pretty interesting because you've got a little under 50% of the people who say they're eating the same, which I found to be very interesting because I might have expected that to be even lower, but a lot of people are really trying to be regimented.
Well,
Um,
it's just the beginning too. So that could,
right.
if you ask this again in another 3 weeks, you might get a different
Yeah. And
response.
that might be a very interesting follow-up poll or follow-up survey, is to say, how have things now progressed the longer that we're in this situation? Um, but if you notice here, you've got about 30% of people eating more processed foods, mostly because they're easy and quick. And then you've
Right.
got more junk food eating. But the most important thing is over a third of people, whether they're eating good or bad, are just eating more, right?
Mhm.
There's no shortage of memes around the internet now about, getting away from the fridge or having access to food or just being bored and eating. And that's going to change how you feel, right? You might feel more bloated. You might have more cramping, and I think it's important to sort of nail that down from a numbers perspective. And then when you look at hydration, because like I mentioned earlier, hydration's key, right? If you're not hydrating enough, can't expect to have good bowel habits. But more than 50% of the people self-reporting saying they're not hydrating enough. They're not getting enough water and liquid in to be able to do that adequately.
Besides
Um,
water, what do you recommend besides water? What's a good way to hydrate?
Yeah, it's a great question. So water's great, tea is great, um, seltzer's great. We try to steer people away from sodas, and coffee's okay to have. Minimum. You don't want to go crazy with it, like we talked about, because of the reflux, and it also can act as a diuretic and make you pee. So it actually has a negative impact for a lot of people. But when we talk about hydration, we're thinking more water, tea, a little bit of juice, and seltzers. Sports drinks are okay to have as well, but you got to remember they're electrolyte balanced for sweat loss. So
Right.
they're great when you're working out, but if you're sitting at home, Gatorade doesn't work as well for you.
Right, and this is hydration helps everything, not just the gut. It's good for your immune system in general, good for your
Absolutely. Good for immune
stress
system, good
levels
for
too.
your skin, good for your stress. Absolutely. Has many, many documented benefits.
So
Uh,
when we're done with this, I'm going to have 2 glasses of water. Like I'm sold. Okay.
that's a good start, but you got the rest of your day to catch up.
Well, I've already had 2, so that'll be
And
my point.
this slide was a very pleasant surprise. So more than 50% of people are exercising regularly, and if you include people who are exercising, uh, you know, 2 times a week or less, about 75% of people are actually getting exercise done, which I thought was amazing.
That's
And
great.
that's a great springboard. But then if you look here, when we talk about bloating, almost half the people here are experiencing more bloating than normal. And
Mhm.
there's a discussion behind it. I mean, we could talk for hours, but I think simplistically, you can argue that the reason why that's happening is because people are eating more, people are eating different, and their bowel habits are changing. And sort of
Pretty
just to
much.
just to prove that point, I ask people, how have your bowel habits been? And about 60% of people are having regular bowel habits. Everyone else is off. So almost
Mhm.
half of people are off. You've got people with constipation. You've got a small percentage with diarrhea, which I would argue and suspect is IBS diarrhea. And then a
Mhm.
bunch of people who have erratic bowel habits, which overlaps again with IBS and with constipation. So it's an interesting discussion, but you it's more of a springboard to really get people to start thinking about how they're approaching this time at home, and what they can do to feel well and to keep themselves safe. So there's a couple kind of easy things that I would suggest to people. I
Right.
would say, first and foremost, keep it up. Maintain a regular exercise schedule. Those people that are doing it, congratulations. You're killing it. You're doing great. And you can inspire the rest of us to get on board and try to get a regular exercise regimen. And that could be doing yoga, doing Pilates, walking, running, anything to get strength and tone, I think is a great idea. um, Adequate hydration, you got to do it. And there's sort of the obvious question is, how much is enough? And, most sources will tell you somewhere between 64 and 80 ounces of liquid a day, depending on your body habitus. So, your average 60, 70 kilo person, you want to get 64 ounces a day. If you're a little bit bigger, that's cool. You just have to get a little more water. And then adequate fiber intake. So when we talk about fiber, we're talking about whole grains, greens, fruits with skin. The skin is where all the fiber is. So if you're having like an apple or a pear or grape, you want to make sure to eat that skin as well. If you're peeling it and you're juicing, there's other benefits. You're going to get a lot of cool vitamins out of it, but you're going to miss some of the fiber. If you
That's good
want,
to know.
yeah, and if you want, you can add a fiber supplement. There's all different kinds on the market. I will say I'm a fan of prebiotic fiber, which is your chewable fiber. So like fiber tablets. Those things tend to be easier to digest. They don't tend to cause as much bloating, and they break down into fiber and probiotics. So they've got other benefits.
Oh,
And
that's
then
nice.
I personally think one of the single most important issues to pay attention to is stress management. And there's a lot of different ways to skin a cat. You could start doing
That's not
yoga.
a good stress management mechanism.
Yeah. But you can start yoga, you can start meditation. I think one of the important things people have to remember is in this era of social distancing, that doesn't mean social isolation, right? I mean, just like we're doing now, it doesn't mean that you can't pick up a phone, or if you've got adequate internet, that you can't do a FaceTime chat or a Zoom chat with somebody to keep those connections and to reconnect with people who maybe you haven't seen or spoke to for a while. And probably the most important thing I'll mention to your viewers is, depression is rampant. And I'm sorry, I forgot to put up one slide where I asked people about their emotional health. And almost 60% of people mentioned that they've got some amount of daily fear or anxiety or depression. And that's not uncommon. And we're all in this together, and it's normal to have those feelings. But if you find that they're sort of creeping in, if they're taking over, you should really avail yourself and contact a mental health professional if you need to, because there's no reason to suffer in silence. There's no reason to have to live with that. And especially now where you don't have to leave your house, and, almost every single doctor and therapist and mental health professional and medical professional are utilizing telehealth. It's a phone call or a video visit away from getting the help that you need.
That's a very, very good point. And it's a life-saving point. So thank you for bringing that up and mentioning that, and also for all of you tuning in at some point and seeing this. If there's anything that we can do in the community to help in any way, facilitate connections with different psychologists or psychiatrists in your area, our networks are large. So let us know too if we can be of any assistance, or if you just need someone to talk to. That's what the community here on Times of Israel is for. It's for building those connections, so we don't feel isolated during these very difficult and stressful times. And Dr. Akerman, thank you for taking the time to be here with us before you see patients, and for being such a good friend to the community, and for giving such helpful advice, and for your patience and your kindness and your generosity with your time. We
Thank you
really
very
appreciate
much. Thank you for having me. I appreciate it. And I hope that this is beneficial. And if there are any questions, I'm always happy if people reach out to me through the community. And have a great day and stay safe.
it. Wonderful to say that. Thank you, and have a wonderful day as well. Stay safe.